All right. Good morning, everybody. Welcome to the FY2025 Small Business Fair. I always have to double check the year because calendar year and fiscal year still throw me off 15 years later into this. My name is Jay O'Keefe. I'm a branch chief here at OAGS for the Training and Development Branch. With me is Mr. Dan Carter.
Yeah, I am Daniel Carter. I am the systems lead at OAGS, so any dashboards you ever see, which most of you don't see because you don't work with us yet, those are the things that I develop. So I'm not a CS, I'm a data guy.
But the data helps.
It does help. Helps a lot.
But we want to welcome everybody. It's great to have everyone here today. We really appreciate folks being able to take the time to come to these events. We really do think that they benefit both sides of the equation, really help us to do business with our partners in industry. And looking forward to a lot of the speakers we have today, a lot of the matchmaking that we'll have later in the day. The contracting officer panel should be insightful, hopefully, if not controversial. If it's not controversial, it's not going to be that insightful.
Yeah, and we're excited to have you all here with, I do want to point out two things. CIFSAN is no longer CIFSAN. It is HFP. So that is a change that we want to make you all aware of, along with ORA is no longer ORA, it is OII. So when you're looking out on those tables, we try to designate that a little bit, but those are happening. Also, if you have any suggestions on how this event could be improved, I will be milling around throughout the day. Please come talk to me and help me understand what would be something that could be improved or be better or make the experience better or more helpful to you as a small business. We're constantly trying to improve this. So just come talk to me. I'm an open guy.
Don't come talk to me about it.
No.
I'm just a pretty face. If you need a pretty face, come talk to me. If you need anything besides a pretty face, talk to Dan.
I got you covered.
All right. With all jokes out of the way, we'd like to introduce the Director of OAGS, Mr. Leonard Grant, for a couple opening remarks.
And he has a beautiful bow tie. Look at that bow tie.
That was the entertainment team. How'd they do? Give them a round of applause. They're gonna do road shows after this. Good morning, everyone. As they mentioned, my name is Leonard Grant. I'm the head of contracting activity for the FDA, as well as the director for the Office of Acquisition and Grant Services. I've been in that position since 2018 and have been really a big supporter of small business and events like today. And so I just want to, because I'll be moving around, but I do want to acknowledge the individuals that did all the legwork to be able to put this event together. So can you please stand and can you all give them a round of applause to everybody that had a hand? I know they're outside still, but those that are checking in, because it really takes a team effort in order to put events like this together, and I think it's important. And you know, the easy part is just coming up here and saying a few words, and then being able to allow the program to happen. But behind the scenes, a lot of effort has gone into making that happen, and I'm very appreciative of that. If there are other OAGS people that are in here, people within my office, can you please stand? Just all the OAGS individuals. So we have, so I want you all to see their faces, because I know everybody would love to come shake my hand. But I'm going to deflect today. These are all the people's hands that you should be shaking. So I'm giving you a strategic tidbit. And I think I said it last time when every time I speak, I'm like, everybody wants to shake my hand, but the people that are standing are the ones that actually understand the requirements, know the requirements, and can really point you in the right direction. I mean, I can do that too, but, if you're doing the right preparation and strategic planning, you should all know that there are people strategically in this room that can get you to where you go, not just myself. Understood? I just gave y'all the cheat code. All right, you all may be seated. Thank you. And I'm going to just take a pause because we're in a remote environment now. So this is sort of different, but although we're in a hybrid environment, which is great. So I'm real enthusiastic about you all coming out and being a part of the event. But it's the same thing in the work world. And so I'm just going to ask you to indulge me for a minute while Sonia McLean comes up to the front. Come on, Sonia, because this doesn't happen often. And she doesn't even know why. And y'all are clapping, and you don't even know why, but that's great. So what I wanted to do, so that you all are witnesses, is to be able to present Sonia with her 10 years of federal service pin.
Thank you, Leonard. Thank you.
And there's a pin for you. So,
Thank you.
There you go. Congratulations. Oh, yeah, she can. There you go.
Thank you, Leonard.
You're welcome. And that's important. Being a federal servant in public health, especially in public health, those sort of things. Now, I'm working on my 35, 40-year pin, but I don't know if I'll last that long, but that's the next step for me. And so as we talk about small business and the small business event, you see the information on the board. I'm going to just deviate a little bit because I know, you know how important small business is to not only to just the American economy, if you will, but more importantly, how important it is to have those partnerships here at the FDA. You know, our mission, public health, protection and promoting public health. And we need your help. We need the support of the small business in order to make that happen. And so much, within the FDA that we touch when it comes to that. They say 25 cents on the dollar is regulated by, is that the number we say that is regulated by the FDA? And so with that mission and with that responsibility, we take what we do, seriously, and we'll continue to do so. And making sure that, how many of you all have pets? All the pets? You have pets, right? Well, the Center for Vet Med, right? They take care of you that. So, just the important things, and we go to the doctors and we have different, we have x-rays, hip replacement, knee replacement, all those things the FDA is touching. And we need the small business, the partnership between small businesses to be able to help us to meet that mission. And so an event like today hopefully will bring that connection together. And so I just want to leave also just 3 Ps. I wrote these down. I had this vision this morning. Preparation, right? That's what, like we prepared to have you all come and be a part of this. You all need to do the same preparation. Understand what the mission of FDA is. I just explained it a little bit, but if you go on our website, you can just see all, FDA.gov and really see what the mission is. And then how can what I do and what I provide, the services I provide can fit the need of the FDA. And I know, you want to try to throw a lot of things and see what sticks, but sometimes it's best to go with your core niche and be good at that and make sure that you're then providing those services. The next thing is partnerships, and I've talked about that, and it's important to have that partnership, but it's also partnerships amongst yourselves. So for those people that have or once had an FDA contract, please stand. So for you all that are not standing, maybe you need to go and look at the individuals that are standing and say, what was the success? Although they're going to hold in their secrets because they want to not do. You're going to sit down. They're going to hold in their secrets, but again, sometimes you have to team, right, or you have to partner in order to build strong. A strong partnership or be able to provide that services. And so like I said, I'm not here to tell you what strategy you use. I just know that sometimes you have to collaborate with others to get what you need sometimes. Or, if you want to go it alone, that's the strategy that's the business strategy you take in order to get to where you wanted to succeed in growing your business and supporting the FDA. And then the last one is perseverance. I think that's important. perseverance is the key. I remember this poem that I was taught as, in my earlier days. Perseverance is the key. Why? Because you're going to knock and you may not even get a return phone call or call. You get what I'm trying to say. It may not be on the first try. It may not be on the second try. I get 100 emails, a lot. I try to acknowledge, but sometimes sometimes you just got to be persistent. Persistence without being annoying, right? We all understand telemarketers, right? You all don't like that when they call your house or they come knocking on your door. You run and hide, waiting for them not to, but we don't do that here. We just, sometimes, none of us stop. No, but anyways, you got to have that persistence. If this is, you feel strongly and committed to what you have to offer, you just got to be persistent in saying, I add value, and I know I can add value to the FDA or what other federal agencies. If you're going in a federal space, I add value. What I have to offer will help us to help the American public. So I just ask that you be persistent. And so as I close and sit down, just take advantage of this day. We have matchmaking that's going to happen. So sit down, ask the questions. We tried to bring in the program people that are the ones that are responsible for a lot of the requirements. Yes, and so just so that you understand the dynamics, where do requirements develop? Someone answer that question. In the program office, correct? I don't make up any of the requirements. The requirements come from the program office. Whatever their individual office or branch, wherever they are located, they have a need. I'm a scientist. I need this. They're developing that. And so if you look at our forecast, and what we try to do is try to pair you with the program so that way you can have direct access to the people that are generating that need. We are just the conduit to be able to then fill that need. So yes, again, you can talk with the individuals that are here within there, and we can kind of tell you sort of what the lay of the land is, or when it's going to possibly be coming on the street or something like that. But trying to connect with the programs is your best bet. As it comes over to us at acquisitions, we have the responsibility, and you'll see our numbers as far as being, making sure that we meet our small business goals. We were very successful this year and have been. You'll see that later. So we make sure we do that. We try to make sure that we're in a competitive spirit, meaning like giving everyone an opportunity to be able to compete for something. But sometimes there are times where we have to do sole source because of the nature of what the requirement is. But most of it, we try to compete. We're trying to promote that competition. We're trying to promote small business. So then it comes to us, and we do the sources sought. We do the request for information and trying to understand what's out there. So all of that stuff is where that comes to us. But what's the key? The persistence, right? We talked about that, the preparation, the partnership, the persistence, and program. I should have added that on there, right? Plus program equals success, right? So again, just take advantage of this. I thank each and every one of you for coming out, and for those that are in the viewing, I guess, now we're in a remote environment. For those that are in my viewing audience, the cyber small business event, same thing applies. And I just thank everyone's participation, and hopefully you all enjoy the day. Take notes. I believe we'll sometime later on, so you don't have to ask that question. Any slides that we have, we'll be putting it out there, making sure that it's 508 compliant, right, Dan? We got to make sure it's 508 compliant, and then we'll be putting it out there so that way you can get this information. I know digitally you'll be taking pictures, but the information will be made available. So thank you again, and enjoy your day.
All right, thank you, Leonard. Appreciate that. All right, so we're going to continue on our way. Also, as a note, we will have a code for Menti after all of this is done for you to also give your feedback. So you can come talk to me, or you can do it through the Menti, and it'll be fantastic. Next up, though, we have Kofo Adenola, and she will be giving us the OAGS overview, so all the wonderful little numbers around small businesses. Come on up, Kofo.
Good morning, everyone, both in the house and online. Thank you, Mr. Leonard, for everything. My name is Kofo Adenola, and welcome to this year's Small Business Affair, where we hope that good matchmaking would happen today. In the next few minutes, I'll be providing information about FDA. Let me move this around a little bit. In the next few minutes, I'll be providing information about FDA and the Office of Acquisition and Services. Here at FDA, we're going to be talking about our mission, goals, organizational structure, goals and statistics for small business for this year, and how we do business here at FDA, and the key contacts that you guys need for today. So FDA is responsible for protecting human health. If you think about it, anything that has to do with human life, pet life, think about it, FDA touches everything. We're here to protect human public health by ensuring the safety, efficacy, and security of human and veterinary drugs, ensuring the safety of our nation's food supply, cosmetics that we all love to use sometimes, and the products that emit radiation. We're also responsible for regulating manufacturing, marketing, and distribution of tobacco products to protect human health and reduce tobacco usage by minors. We also help to speed up innovations that make medical products more effective, safer, and more affordable, to getting accurate science-based information needed to maintain and improve public health. We play a very significant role in the nation's counterterrorism capabilities, ensuring the safety, the security of our food supply, fostering development of medical products to respond to deliberate and naturally emerging public health threats. Now let's talk about the Office of Acquisition and Grant Services, our mission, vision, and goals. So sorry about that. Our mission is to provide high-quality acquisition and assistance agreement outcomes to FDA. And our vision is to foster strategic collaboration with our partners and empowering our workforce, which is very important, to achieve results that protect, promote, and the health of all Americans while maintaining public trust, which is also very key. And our goal is to build effective partnership with our FDA customers and stakeholders to mature our acquisition practices, institute a performance culture, and develop our organization and our people. This is our structure right now. You guys have heard from our able leader, Mr. Leonard Grant, and Ron Loeb as our associate. We have 2 vacant positions right now, and then the directors for all the different divisions are right there. Here you can see our OAGS, Office of Acquisition and Grant Services, actions divided by center, CEDAR, ORA. I think Dan talked about that. ORA is now OII, and ODT were the biggest customers in FY24 by volume. ORA, which is the Office of Regulatory Affairs, has changed to Office of Inspection and Investigation. You will learn more about FDA's reorganization during the Human Food Program presentation coming up later on this morning. Based on dollars, CEDAR takes the lead again, followed by ODT, which is the Office of Digital Transformation, and then OC, Office of Commissioner. The slides will be shared so you'd have all this. Now let's talk about our socioeconomic goals for FY24. The FY24 small business figures for FDA is still being finalized, but the draft results are very promising. We are happy to say that we are on track to exceed all of FY24's goals and we've awarded almost $770 million to small businesses. I think we deserve it. I deserve a clap. And then we hope that for FY24, we're even going to surpass that. These are some of the vendors and NIAC, North American Industry Classification by Code. Those are the current top 10 vendors, and then the top 10 NIAC codes. And here is our top 10 small business vendors, as well as the top 10 based on the NIAC codes. So you want to pay attention to that. Next, let's talk about the competition data for FY24. The FAR requires contracting officers to promote competition to the maximum extent practicable. HHS sets two competition goals for FDA. FDA met the HHS target goals by actions, completed about 65% of that. Yeah, however, we did not meet our dollars competed goals, but we hope that for FY25 we will be able to meet that. OAGS will continue to work together with the centers and offices and stakeholders to maximize the competition for FY25. So considering other things, one of the things that you want to focus on when best practices for doing business with FDA, it's target your engagement. Know your primary NIAC codes. Consider teaming. Mr. Grant talked about that already. Consider teaming with others. Learn about the FDA market and the goods and services that we procure. Read the memorandums to improve your engagement. Engage with Cindy Anderson, who is our FDA small business specialist. And then also get familiar, participate in outreach programs like this, and also get familiar with the SBCX website, which was created to foster collaboration. And also, that website also includes forecasts on what the government is doing, what the government is going to buy. Search for FDA when you go to that website. You'll be able to see, get more details on it. Like I said earlier, it's to create and foster partnership opportunities between vendors. So we highly encourage you to visit the SBCS website. And then own your future, right? We talked about knowing your target. We talked about developing allies. Then it's up to you to own your future. Go on the SBCX website, review all the focus opportunities that are there. And then if you've not registered, please go ahead and register on that website. Understand how to write a capability statement. Know how to write an effective, concise capability statement. Those are things that would help. Read past cases of GAO case decisions and know your FAR. So doing business with FDA, important resources for all businesses interested in doing business with FDA. Go to the EBID board. Specifically, the EBID board was designed to promote awareness of competition. Awareness of and competition in business opportunities for contract actions between $1,500 to $2,500. So you may also want to get familiar with that. Small business outreaches. You can go on the website. You have access to the previous recordings of the small business fairs that we've done since 2014. And that concludes my presentation today. Thank you, everyone, and good luck with the matchmaking.
All right, thank you very much, Kofo. Appreciate that. A lot of good information there in those slides. Get to know OAGS a little bit better. And now you're going to get to know us on a little bit more of a personal level. We have the contracting officer panel coming up, so I'd like to introduce Ms. Maria Finan, Ms. Michelle Dakanai, and Ms. Kim Davis. Now, a lot of your questions, yes, absolutely. a lot of your questions were pre-submitted, so we did go through those, try and pick the ones that we thought would be the most beneficial for all here and the most relevant. But as we get through these, if we have time, we may have the opportunity to open it up for a live question or two. But I'm going to go ahead and get us started here. I'm Jay O'Keefe again, by the way. All right, so first question. What is FDA's process for adding items to the HHS SBCX forecast? I'm going to let Michelle take this one.
So this process is between the FDA centers and offices working with our finance and budget office. Things really start to get finalized in April of, prior to the beginning of the new fiscal year, where they're finalizing what it is that we're going to be purchasing this coming year. And so they take that information, give it to OAGS. We filter through it to take out some of those opportunities that might be exercising options or issuing orders off our internal IDIQs, BPAs, and then we take that information and post it on SBCX. So the information is updated quarterly. There could be new, things that come out, new programs, or maybe budget constraints that happen throughout the year. And so we update it quarterly and provide that information to the vendors on SBCX. So if you don't know where to go on the SBCX website, scroll all the way to the bottom, and there's, in the search, put in FDA, and it'll pull up our forecast.
Yeah, thanks, Michelle. Next, how does the FDA prioritize small business engagement in its contracting processes? So we'll start with Maria.
Okay, good morning, everyone. So obviously working with small business in the contracting field is one of the most important things that we do. Small businesses, as everyone knows, are the backbone of America, and we really strive to make sure that we get dollars into those small businesses. So I would say one of the kind of first things that we do is in our market research, and the market research is done by our customers and by contracting. Specifically, as part of our market research, we are looking to see whether or not we can find small businesses that are capable of doing what we need them to do. So I would say if you have websites, make sure you've got some things out there on your websites that really show us work that you've done, that we can see what you're working on, what you're doing. I would say definitely another way, so because I'm just going to go back and say, if all of you are small businesses, or even if there's large businesses out there, everyone is familiar with the rule of two, right? So as long as we find two small businesses, we are supposed to and required to set that aside for small business. So that's why the market research phase is so very important for us to be able to find that information about your companies. Another way that we find that during market research is by posting requests for information, right? Or another term might be called a sources sought. I'm going to say, as someone who's been doing government contracting for 24 years, I absolutely understand that small businesses have probably a very limited bid and proposal budget, right? So you're not going to be able to necessarily spend all the time that you need to on some of these RFI responses. I would still encourage you to send something in, even if you can't specifically tailor it to what we're looking for. Letting us know that you're out there is at least better than not knowing that there are interested small businesses out there. Does that mean that we're going to be able to set it aside for small business? Can't guarantee that, but we at least, and so again, I just want to say I understand that you can't always respond to those RFIs, especially the ones that come in September at the end of the fiscal year, or we're looking for something. But I would say if and when you can, send in responses to the RFIs. It would be really great to see you include in those responses similar work that you have done. It'd be really great if you could even give us contract numbers in that generic response. So I might encourage you to have, as part of a capabilities brief, something that lists your core areas. And obviously, how do we involve you in contracting processes? I would consider this small business fair also part of our process, right? We're getting out there, showing you who we are, how you can get in touch with us. But I would say if you all could see the documentation and the requirement that we have to not set something aside for small business, it is pretty hefty. So, again, we are really looking for you during our market research phases. And I can't remember if this goes to another question, Jay, so I'm going to say it here, and that is one of the things you also have to keep in mind, and a lot of people tag onto the contracting people's names, right? Oh, you're the contracting person. You have to remember, though, we are not the technical people, right? So you can send us something and say, hey, can I talk to you? I may know nothing about the work. I know how to write a contract. I know how to negotiate. So keep in mind sometimes contracting, may be like, oh, you need to talk to, our customer or whoever the program office is. So that's another way. I would also say in the contracting process, we are much more open and available to talk before an actual requirement hits the street. So, once something hits the street, we really have to be careful and monitor our communications so that we don't give someone an unfair advantage. But I would say for small businesses, the biggest place that we find you in our processes are market research. But again, that's not just contracting, that's also the customer base. I would also say encourage you to make sure that your SAM registration is up to date. I do believe we are also still using SBA's Dynamic Small Business Search, which I've been doing contracting 24 years, and DSBS has looked like it looked for 24 years pretty much. I will actually tell you, I did contracting at SBA, so I was doing operational contracting. I met the individual that developed DSBS. It was one of my contracts, so it was supposed to be updated. No big surprise, funding fell through, so, but, make sure your DSBS is updated. Make sure that you really have listed your primary NAICS codes so that we can really find you if we're doing those types of searches, because those are some of the things that we do look for. We look for the NAICS codes that you're under, if you have any sub-socioeconomic, the 8A, woman-owned small business, economically disadvantaged, veteran-owned, service-disabled veteran-owned, hub zone, all of those. Just make sure that all of that is current and up to date so that we can really find you when we're looking for you. So is that good, Jay? A little too much?
No, I think that was great. I think you hit on a lot of good points there. SAM, especially Dynamic Small Business Search. The market research phase is the phase where we find you, especially those program offices, because once that market research phase is done, I know a lot of them don't want to go back and do more. So whatever they find in that first market research phase, they get pretty locked into that. And it's hard to start changing minds and say, oh, well, did you find a small business? Did you find this company? If they don't find you in that first run, it might be too late. So making yourselves visible is key. So
yeah, and I'm just going to say one of the hardest things I ever had to do was when I worked at SBA, and a customer would come to me and say, oh, small businesses can't do this. And I would say, you do understand what agency we're working for, right? The Small Business Administration. And so, I had to say that, many times. And all of you, if you saw the small business goals for FDA, I think it was right around 35, 36%.
It's up there.
When I was at SBA, it was around 70%. And of course, because that's the goal of that agency, right, to help small businesses. But anyway, so I thought I would share even at the SBA, I had to tell program offices, we need to be looking at small business. So,
yeah. Thank you, Maria. And Kim and Michelle, also, if you have anything to add, feel free to jump in before for any question. Next, when is the best time to reach out for capabilities briefings, and how best can companies schedule capability briefings? How can they get in touch with COs if they're not getting responses on calls and emails? So, Kim, I'll let you start this one.
Okay, well, the worst time to get a hold of us is fourth quarter. So that's the worst time. Any time before that is totally fine to reach out to us. The small business fair we had last fiscal year, I took, I would say, about 40 cards from various companies that attended. I probably took 35 meetings out of those cards. So I think out of that, I don't know how many of them got awards, but I passed their information over to centers. It does work. So anytime is a good time, but fourth quarter. That's the only time that's a bad time. As far as how do you get in touch with COs, that's a little tricky. Persistence is one way. Most COs do email, they do call you back. It takes a little time, I will say that. But we all pretty much do respond back. I don't think there's very many of us that don't. OAGS is really good about that. And if you don't get a hold of one, you can always call one of the others and say, hey, can you go over and touch somebody and say, I need to talk to them? And we do. We all work together as a team. So I don't think we have that problem. What was the other one?
I think that's it. But, kind of, and going along with what Maria was saying earlier, too, the COs are one source, but it's arguably more important that you're reaching out and providing those capability briefings to the program offices. The program offices define their requirements. We just help them refine them. So when you email a capability briefing to a CO, sometimes you get them at that lightning strike moment that they're already, in the planning phase of an acquisition with a program office, and they say, hey, this would be a perfect fit for that one we're already working on. But if we're not already working on it, we don't necessarily know what their needs are going to be 6 months, 12 months, 18 months down the line. But they have an idea of that. So it's just as important that you are reaching out to the program offices, to your points of contact within the centers to make sure that they know that you're out there, that you exist, and that they can keep your card in their back pocket for the next time they have a good acquisition fit, because it makes their market research a lot easier if they already know you're there.
Well, and a lot of times from the meetings that I took, I passed along those corporate capability statements over to the program office. So that also helps too. So
Tying that tidbit back to the forecast, if you don't know who is in the centers or offices, the forecast has that information. They have a point of contact that you can reach out to. The extension on our email is the same for all of us. And typically it's first dot last name.
That's true. Unless you're me, mine is more difficult. It makes me harder to find.
And then, Jay, and can I stand up? I feel like I can't see everybody back there in the back. So, so I was just going to say, please do not take it personally if a contracting officer says, no, I don't have time for a capabilities brief. So it doesn't mean that we're not interested in your company. It just literally means we have day work to get done. The other thing that I might encourage you to talk to the program offices about, you might ask them, have you considered having an industry day, especially if it's something new, if it's something that hasn't been done, or maybe that the industry, that your industry has changed. Maybe even, kind of put that bug in their ear, hey, have you thought about having an industry day, which is kind of a smaller version of, the small business fair. So I have done industry days. Obviously, during and after COVID, a lot of them have become virtual, not so much in person. But I just want everyone, if you take nothing else away, I just want you to know, please do not be offended if a contracting officer says, I don't have time for a capabilities brief, because they probably really don't. So, and again, as Jay mentioned, really talking to the program offices, because they're the ones who are working on that. The last thing I'm going to say is, please, please, please do not try to sell your one single solution, though, to the program office, because there is nothing harder than when they come to us and say, I need this company to provide this software, this specific. That's where contracting has to turn around and say, are they the only ones? So, just be mindful of, I understand you wanting to get your foot in the door, you wanting to get seen, you want to get noticed, but just remember that we are probably not going to be in a non-competitive arena. So, sometimes that's a hard one on capability briefs because they feel like, oh, you sold them on it, now they're going to sell us on it. So that's all.
All right, thank you very much.
Real quick. Cynthia Anderson. All right, because no one said this, but stand up, Cynthia. This is FDA Small Business Specialist. So that's another conduit that you might, and she's going to be here available to talk with. So when we talk about scheduling capabilities and how to do business with the FDA, Cynthia is that person, is that liaison to be able to help us. So you don't necessarily have to say anything. And then I also have Anita Allen from CMS. So she's here today too to be able to, so you can talk with them. So if this is not, if the program is, obviously you want to be able to talk to program and talk to the specialist, but more importantly, these are the conduits, your small business specialists. So I at least wanted to acknowledge and show that I'm always giving y'all resources, right? All right. She'll just walk in the door and she's going to kill me when I get out of here. But anyway, so if there's anything you want to say about that, then let's Cynthia also add to the conversation.
I think it is, or you could turn it on. There's a...
Testing. Hello? Okay. So I'll just reiterate what the panel, the wonderful contracting officer panel that we're having right now has reiterated, and I'll add one other thing. If you have an SBCX profile already, please make sure that it's complete. And what I mean by that is SBCX allows you to link your dynamic small business profile. It allows you to add keyword searches. It allows you to upload your capability briefing. It allows you to consent to our partnering portal. If your account is not searchable, it means that if our contracting officers want to find you, they probably can't. So if you set up a meeting with me, one of the first things I will do is go to SBCX and look at your profile and see if it's complete. If your profile is not complete, then you're not searchable to our program offices or our contracting officers. So in addition to a lot of the other great information they've given you, that is a key point that I wanted to reiterate. And you've heard it many times that the program offices are the ones that generate the requirements, and they really are the ones that need to know your capabilities and that you're out there. They take the first stab at the market research. They're working on the acquisition plans first and foremost. They're the ones that need to know you. We want to get to know you and your capabilities, but they're the ones that are your first line of sight in terms of trying to get your business known and recognized and tied to a requirement that you're interested in pursuing. So,
all right.
I'll be around this afternoon if you need to see me.
Thank you so much. All right. What are some unique attributes about FDA procurement that contractors should know? And I'll let Michelle start with this one.
So I'm going to pull it back from just FDA procurement practices and kind of take a bigger picture of what drives our procurement processes. So a number of years back, the Office of Management and Budget, OMB, they came out with a strategy called category management. And so what the driving, what this was about was taking a look across all departments, all agencies. Too loud?
No, closer. You're not loud enough.
Okay. And looking at the common goods and services that were bought, they categorized this to take a better look at how federal spending was done. And so with that in mind, it was to drive efficiency and, bring to light more accountability with how we're spending money and to make things more efficient and more effective for government procurements. And so there's a lot you can research out there about what it is, what category management is, but it's really to streamline our procurement processes. So within category management, and I'm not going to go into like the nitty-gritty stuff, but they break it out into 4 tiers. And so one of the tiers that I'm going to talk about today is about best in class. So best in class vehicles are designated by OMB. And so they've been vetted, they've been determined to be, highly effective and, just bring, it's good vehicles for us to look at first, right? So we're not looking at necessarily individual contracts and things like that. So that's kind of the wider government-wide picture when it comes to what it is that we do when it comes to federal procurements. Now, what does this mean for the FDA then? So taking category management in mind, HHS came out with mandatory use contracts and then also mandatory consideration contracts. And so when, going back to market research, which is, what Cindy and we've been talking about, during the market research process, we take a look at these mandatory use, mandatory consideration contracts. So I'm not familiar with the mandatory consideration contracts because I'm in DITA, I'm in the IT acquisition office, and so, but category or mandatory consideration contracts are in the fields of medical and then transportation. So from what I recall with transportation, I believe it's off the federal supply schedule. Medical, there's some HHS agency level IDIQ BPAs, but there's also, I think, Schedule 65 off GSA. And then the mandatory use. So that covers IT, professional services, and office supplies. Office supplies, it's off the federal supply schedule. Professional services, there's a variety of them. So some of them are at the individual HHS agency level, IDIQ, BPA contract vehicles, OASIS, or GSA OASIS, vets. Not as familiar with the professional services one either, sorry. And I believe the GSA professional services mass category. Now IT, it's not just limited to necessarily, again, just HHS vehicles, but some of the ones that are mandatory use ones for FDA is NITAC, CMS Spark, SOUP, and then the GSA, formerly known as IT-70. So that goes into our market research, and then, from there we figure out our acquisition plan.
All right, thanks, Michelle. Next question, and good one for today. What makes a small business stand out to a contracting officer? What are some traits you've seen in successful small businesses that make them a good fit for government? Kim?
Just the fact that you're a small business makes it that you stand out to us. We're always looking to do business with the small businesses. I'm sorry. Stand up. Yes, just the fact that you're a small business stands out to us. The traits. I think Cindy hit on a lot of that. It's, your key points, your traits that you have should be on your, oh, that's my phone. That's my watch. It should be on your corporate capability statement. The one thing that I really stress a lot of times is that your UEI number needs to be on your corporate capability statement. It is so hard to find that number. And a lot of times, I'll be honest, I find your number, or I think it's your number, it's not your number. It's not your company. There's so many different companies out there with similar names, and if you don't put it on there, I have a hard time finding it. I don't know if I'm the only one, but that is a key thing that should be on there, along with all your NAICS codes that you qualify for. That should be on there. And a lot of times when you come to corporate capability meetings, the worst thing you can say, in my opinion, is, When I say, you know, what are the things that you do? What are you good at? And then somebody says to me, well, what do you have that you can offer me? Okay, that's not what we want to hear. We don't want to hear that. We want you to come to us and say what you can do for FDA. So that is something that would make you a good fit for us. You coming to me and asking me, that doesn't help me. Just knowing what you want to sell to us is a good way to fit for FDA. So I'm going to let Maria talk.
She'd like to let Maria. And just so y'all know, I'm actually, I think I said new to FDA, so I've been with FDA not quite 6 weeks. But I'm just going to say something really basic about what makes it stand out to me as a contracting officer, and that's contractors that perform the contract requirements. I mean, that sounds really simple, that sounds really easy, but a contractor who's in there doing what is in the contract, or I'm just going to say what goes beyond the contract. One of the other things I think, so, you know, talking about traits, a good communicator, right? So if you're communicating, so let's say you are struggling with this contract, with some area of performance. I, as a contracting officer, would much rather have that small business start talking to me before it's too late. Start talking to me about what we can do to help make you successful. I have a situation right now where we have a contractor who has not been able to perform, and it's a small business. And the small business, when we started meeting with them, they said, well, we just know you want to terminate our contract. We just know we know we haven't been performing like we're going to. We just know you're going to terminate us. And I said, part of my job is not to hurt you more. Part of my job is to work with you to try to find a way that you are successful so we are successful. So early communication, if something is happening that's causing performance issues, please, that early communication and open communication with your contracting officer will go a long way. Another thing that Kim said, you mentioned the UAI. I'm going to tell you, I feel like SAM.gov changed, because it used to be on SAM.gov, I could find email addresses for who your points of contact are. We can see the name. We cannot see an email address anymore in SAM.gov. So I would say if you have a website and you have our federal contracts point of contact is with an email address, throw that out there on your website somewhere. I can't tell you how many times I've gone to a website and it's like, contact us, and I'm resorted to putting in a form that normally goes to a sales, office. But so I would say, what makes you stand out? One, you care about the mission. Two, you're doing the job, and good, clear communication. So pretty basic, but I thought I would say it anyway.
I do want to add to that just real quick, right? Speaking specifically as contracting officers, your technical capabilities are what make you stand out to the program offices. They define the requirements, but it's the communication and the performance that stands out to us, because the program offices know who the large companies are that can do what they need to do. As soon as they have a requirement, they know 1, 2, 3 big names that can do what they need them to do. It is sometimes more challenging for us, and we sometimes have to lean on the regulations that say, no, you have to go to a small business. And so when you have performance issues that are not communicated early and addressed as quickly as possible, it starts to poison that well for everyone. I had a horror story. We had a small business that was not holding up their end of the bargain on a contract, and I know that the next time that program comes to me with a requirement, they're going to do everything that they can to avoid going to a small business. So, like Maria said, I'll be the first one to tell a program office that termination is the last option, because everybody loses in that situation. I would much rather fix the problem, and it's easier to do that sooner rather than later. All right. Explain the key stages of the contracting process from proposal submission to contract award for small businesses. Maria?
That's secret. We're not going to.
It's all in a black box.
Sorry. I had to make sure everybody was still awake. Key stages of the contracting process from proposal submission to contract award. So when proposals come in, one of the first things that gets done is we make sure that everything has been submitted as it was supposed to. So if it says submit volume 1, 2, and 3, and here are what's supposed to be in each of those, it's kind of more of a housekeeping check, right, to make sure that you submitted everything. A key part of that is if there have been page limit restrictions. We're looking for page limit restrictions because if you go over the page limit restriction, then anything beyond the pages gets, lopped off and taken off, and unfortunately that can cause you not to be considered because you missed that. So that's kind of one of the first things that we look at, in addition to pulling reps and certs out of sam.gov for each vendor, making sure that you're out there registered and active. Then we move to actual evaluations, and I'm going to say this is a generically we do technical evaluations first. In fact, depending on the acquisition, normally, and I'll say the technical evaluations are composed of generally people from the program office world because they're the technical experts. They may also utilize subject matter experts just to help them interpret, but they wouldn't be considered an actual evaluator. So they're going through doing the technical evaluation. Normally at that point, we have not even given them price. So we do not want technical evaluations to be influenced if they see a vendor's price, whether that price be a high price or a low price. We do not want technical evaluations to have influence of what a vendor's price is. So normally they only get the technical proposal. A lot of times, so if you've ever wondered, why do you want this separate from this and this separate from that? Because it makes it easier to send out to who's doing that part of the evaluation. So we would normally go through technical evaluation. They would only get your technical proposal, and then they would start documenting. And I'm going to use the term strengths and weaknesses. Those are some very specific terms for us, but I'm going to use them generically here. Strengths, weaknesses, we might call them benefits. And the evaluation team is going through looking at your proposal based upon what we said we were going to evaluate. So that's very important that you understand in the RFP or RFQ that you understand what we're evaluating. So for example, if we say that we are going to evaluate your management approach, and then the technical panel starts saying, I don't see a staffing plan. Well, we didn't ask for a staffing plan, so we wouldn't be evaluating a staffing plan. So the technical team will evaluate what we said we were going to evaluate. And contracting normally sits in and listens and tries to keep them on track. Like we try to be the ones who say, no, we didn't ask for a staffing plan. Don't be writing up, something bad because they didn't submit a staffing plan. We didn't ask for a staffing plan. So once technical evaluations are done, sometimes by the same team, sometimes by the different teams, a lot of times we also have a past performance evaluation going on. And so we may be looking at past performance. I'm going to say as part of technical, we can sometimes see experience. And I don't know how familiar you all are. I'm going to very quickly tell you what the difference from the government's perspective is about experience versus past performance, okay? Experience is your resume. This is what I have done. Past performance is your annual appraisal from your supervisor. This is how good I did the work that I did this year. From a contracting perspective, those two can be very different. Past performance, as most of you probably know, past performance, if you do not have past performance, that cannot be held against you. That's considered neutral. If we are specifically looking for experience, as part of a technical factor, and you cannot show us experience, that can be used to lower your rating. So I hope that makes sense. Resume, annual appraisal, your resume, if it doesn't show the experience, you can be rated lower. Past performance, if you don't have any, it's a neutral. It should not hurt you and it should not help you. So I just want to kind of throw that out there. So we've done technical, we've done, if we have experience as part of that, past performance, and then we get to price. And when we're doing price evaluations, we're asking the technical team, hey, does their price coincide with what they proposed in their technical? So if you read in their technical that they're going to give you these 5 people, have they priced these 5 people over here? So just making sure that there's a good crosswalk, that the price coincides with the technical. Once we do that, the evaluation teams will come to a consensus as to, maybe we'll call it the most highly rated, and provide a recommendation to the contracting officer on who we should award to. All of that is documented in multiple documents, same information, we just copy and paste it. Now, I wish I were joking, I'm not.
Maria, I don't want to cut you off,
okay.
but I do want to get to the last question.
Okay.
Yep.
So we document it. If we have to go through any internal reviews, that'll go through internal reviews. Then we make the award and we notify unsuccessfuls. I could talk a lot longer though, Jay.
Oh, I know. That's I could talk all day about acquisition process, and then I'd put everyone in here to sleep. But I'd feel like my 15 years were worth it. But I think this is the last formal question we have, and I think probably the last one we're going to get to today, but the most relevant for everyone in the room, I hope. Tips for successful matchmaking. So we're just going to go down the line, lightning round. Kim, go ahead and start.
Stand up, right?
Yes. So if you give bad advice, they know who to blame.
I'm going to be quick. Know your center. Plain and simple.
All right. Michelle?
Look at the forecast and come with ones that you're interested in, so that it's not just, well, what can the FDA do for you?
Absolutely. Maria?
I'm not even going to stand up for this one because I'm just going to say what they said. So absolutely, know who your customer is and take a look at that forecast so you know what you want to talk to us about.
Absolutely, and that's true for the matchmaking sessions today, and it's true for sending those capability briefs, sending those cold calls to your program offices, to your contracting officers. Don't say, what do you have for me? Tell us what you have for us. The elevator pitch for your company is key, and like I think Maria said earlier, it can't just be, here's the one thing that we do, because if you only do one thing, then unless we need that one thing, you're out of luck. But tell us what area you specialize in, what needs you can meet in a broader sense, and how you can take that expertise that we know you guys have, because small businesses do have some of the greatest expertise in the world. The innovation is unmatched in the small business community, and that's one of the reasons that we want to get to you guys, but you have to be able to communicate what that expertise is to us. And the best way that you can do that is to know the center, is to know the forecast, know what requirements you're targeting with your expertise, and then give us that sales pitch that says, here's why my company can do what you need us to do. So thank you very much to my contracting officers. Appreciate all of the information today. You saw their pretty faces, so you can find them in the crowd if you need to. Get with them later today. And you can ask me as well. I'm happy to answer any questions anybody has, but I'm going to turn things back over here to Mr. Dan Carter.
Thank you all very much. That was very informative. Lots of good tips and tricks there, folks, so write those down and work with them. These guys know what they're talking about. They're fantastic. Next up, we are going to hear about the Small Business Innovation Research at the FDA by our branch chief for the grants, Stephanie Bogan. So come on up, and you're all in for a treat. She's a great presenter.
Oh, perfect. Good morning, everyone. My name is Stephanie Bogan. I hope you are having an amazing morning, and this session is off to a great start. As shared, I serve as branch chief for the Grants Management Branch within the Division of Grants, Agreements, and Acquisition Support. And I'm going to add to Leonard's piece this morning. Our work happens at the intersection of 4 Ps. That's partnership, programming, policy, and processes. So with the partnership, we partner with centers across the FDA to understand the programs that they're seeking to stand up and ensure that those programs are designed with the parameters of HHS grants policy and aligned with the processes and systems that we have in-house to support them. So something a little bit about me, I'm a runner. I'm also very passionate about small business and entrepreneurship, and I believe that it's really important for small business owners and entrepreneurs to have a safe place to land their ideas. And so instead of just talking about SBIR this morning, what I want to talk to you about in about the 10 minutes that I have with you today is federal financial assistance in general for small businesses. Federal financial assistance is a really broad term that encompasses both grants and cooperative agreements, which is typically what we tend to award at FDA. And so I'm going to focus in here on something that I picked up when we did a similar session at another event for small businesses, and that was there were a lot of questions around how do I find federal financial assistance and where or how do I apply for it. So really quick, 2 things to take away for you today: finding federal financial assistance, applying for federal financial assistance. I'm a native St. Louisan with a very southern grandmother. She's from Mississippi. So I'm just going to ask, what do you see on the screen? Ooh, y'all good this morning. We love to see it. Okay, so my very southern grandmother would say things that nowadays it's like LOL, laughing out loud. So we're going to play a quick game here. What do you think that stands for? Let's go. Okay, very good. Finding federal financial assistance might sound like finding a needle in a haystack, right? But it's not. And that's all because of grants.gov, this lovely repository that allows you to go seek and find federal financial assistance. And you can do that by clicking the search grants option here on the home page for grants.gov. And then there's that haystack, right? So there's a lot of grants and cooperative agreements out there. But where we're going to narrow it down is looking very specifically for what's out there for who you are. What are you eligible for? And you can search that by small businesses, and then you can also narrow it down even further by agency and things of that nature. Why is this important? Because finding a needle in a haystack takes a lot of time. Sometimes the hay will prick you and it feels like a needle, but it's not the needle you're looking for. This platform is going to get you where you're trying to go. So once I narrow it down for small businesses, and in this case, I even narrowed it down even further to just FDA, boom. I didn't even know we had 4 open right now. So we learned this together, family. So there are 4 opportunities, and I'm not going to go in depth about the opportunities because, as I mentioned, we partner with the centers on the specifics. But I do encourage you to go on this journey, take an opportunity to read through these opportunities that you are eligible for, and notice that they have some kind of out there close dates, and that's because oftentimes we have rolling receipt dates for the applications, and there are different steps. You may have to submit a letter of intent, things like that. So really take the time, unpack what's there that you're eligible for, and then make decisions around if you'd like to seek out those opportunities. So we talked a little bit about what they say you're eligible for, but then there's what was created for you, and that's our small business funding, where within HHS, 24 NIH institutes and centers, along with CDC, FDA, that's us, and ACL, fund scientists and entrepreneurs working to bring their discoveries to patients or to the public, to move that needle on advancing public health, and this is really important. So this is a big, what we call solicitation that is open. It does have rolling receipt dates, and we are a participating agency. So there's what you're eligible for, and even more importantly, that's what was created for you, right? And this is how you find it all, right, on grants.gov. Going real good on time. I'm proud of myself. I'm a talker, but I like conversation, so that's why I asked y'all to talk back to me. All right, so applying. Now that you found it, how do you apply for it? The same place. You're still on grants.gov. Isn't that wonderful? Like, you don't have to go nowhere else. I love it. Okay, so you're going to learn. Go to grants.gov Learning Center. There's a whole realm of information out there. You can quickly learn about grants, cooperative agreements, how to, get on your way. Check to make sure you're eligible before applying. How do you do that? I told y'all I like conversation. All right, thank you. Research. Utilizing the tool that you can narrow down, you're eligible, you know that part, but just taking a look, reading through the announcements. So you search, you register, you can sign up with grants.gov. They have a lovely workspace that kind of helps usher you through the steps of applying for these opportunities, completing your application, and then once you do, you never have to worry about where it is because the system will help you track it, right? All the way through completion. So I have done well with my little bit of time here with you all today. Was it impactful, friends? Very good. Okay, I'm Stephanie. Feel free to keep in touch with me.
All right, see, I could have let those contracting officers talk a few more minutes, but that's okay. So we are going to move right along. I'd like to introduce Mr. Matthew Baker, Division Director for the Office of Resource Management. Going to take a few minutes to talk about the Human Foods Program. Matthew?
The green button? Thank you, no problem, thanks. All right, well, good morning, everyone. My name is Matt Baker, and I'm the Budget Director for the new FDA Human Foods Program. For those of you who are familiar with the legacy FDA structure, the first question you'll have is, what is this Human Foods Program? What does it consist of? And essentially, the Human Foods Program is made up of the previous CFSAN, which is the Center for Food Safety and Applied Nutrition, plus certain previous functions from within the Office of Regulatory Affairs, or ORA as we call it here. The two main organizations that transferred to the new FDA HFP are our Partnerships Office. That office really kind of oversees and manages our Integrated Food Safety System program, which is mostly cooperative agreements with our state and local partners. In addition to the transfer of ORA's field laboratories, which are now part of HFP, they do processing and sample testing, applied research, and they assist with compliance and oversight activities and so forth. So overall, compared to the previous CFSAN, HFP is roughly twice the size of the legacy CFSAN organization, which actually makes this the largest reorganization in recent FDA history. So there's a lot going on. It's an exciting time for us right now, but a tremendous amount of change, as you can imagine. So this slide outlines our vision and mission statements, the vision being that the food supply is a vehicle for wellness. And then this mission statement really kind of leans into our so-called 3 risk pillar areas. So the protection and promotion of science-based approaches to prevent foodborne illness, that really kind of addresses our microbiological food safety. So if you think about E. coli, salmonella, various viruses that can be in your food that can provide various forms of illness, that's one of our main sort of focus areas. A second is really focused on nutrition. That's where we're referencing that through reducing diet-related chronic disease. And then the third aspect of this is ensuring chemicals in food are safe. There's a variety of ways in which chemicals can be in your food, sort of either added intentionally through various preservatives and things like that, or through various migrating to food through food contact substances and wrappers and packaging and some things like that. And so this new mission statement is really focused on kind of referencing our risk management approach across those 3 kind of main functional areas. So here's a quick sort of snapshot on our Human Foods Program. This slide really kind of gets at the huge field of play that our organization covers. Food and agriculture touches about 1/6 of the American economy. And so the field is vast, and you see some sort of key stats here. We're talking over $1 trillion worth of sort of food, dietary supplements that we oversee and regulate. There's more than 200,000 various food facilities, whether that's manufacturing facilities, whether that's organizations that transport or sort of hold food and so forth, both domestically and abroad for firms that export food into the United States. And we do that with about 2,200 employees. So if you think about sort of the trillion-dollar landscape, all the sort of food that we oversee to make sure that it's nutritious, wholesome, safe from harmful pathogens, we do that for about the cup of coffee per American per year. So it's a pretty good value if I don't say so myself. So we have a vast array of products and programs within our organization. It's a wide diversity of food products, sort of how they're labeled. We manage lots of different types of programs, from a few pre-market programs to some post-market programs as well, in addition to cooperative programs that are managed and supported by our key staff, particularly that Office of Integrated Food Safety System Partnerships that was recently transferred from our ORA office to the new HFP. We do about, in the legacy CFSAN structure, about 90% or so of our work was in the post-market space. And this is actually a really key difference from the rest of FDA because most of FDA is, as you know, focused on pre-market. So, the onus for proving the safety of a given product often falls on industry. So it falls on, the drug manufacturer, the device manufacturer to prove to the agency that that product is safe. Because we are principally a post-market focused organization, the onus falls to us to prove that a certain product that could already be in the marketplace is potentially unsafe or has a concerning risk profile. And so it's just a fundamentally sort of different organization than a lot of the rest of FDA. So I mentioned before that the reorganization of the FDA food space was the biggest reorganization in FDA history. That is in fact true, and it's in fact been going on for 2 years. As some of you may recall, there was a major incident regarding infant formula several years ago where there were some major shortages, and there's just some fundamental realities that we didn't have sort of sufficient organizational structure and resources necessary to kind of fully perform our mission space. And so there were some external reviews from external panels and so forth, and ultimately the Commissioner of FDA, Dr. Califf, landed upon a new vision for the organization of the FDA Foods Program, and that's where we are sort of operating under today. Fast forward, through the various steps of making this happen, and we are now sort of officially having sort of flipped the switch on the new structure as of October 1st. As you can imagine, given the change of this magnitude, the implementation is still very much ongoing as we sort of build this new organization. But we are now operating in this new Human Foods Program structure. This is a new org chart for the new organization. So we have a deputy commissioner specifically focused on human foods. We have 2 kind of chief of staff and strategy offices that report directly to the Human Foods Commissioner. And then these 3 offices in the top row on the left, that nutrition office, the micro food safety office, and this quite a mouthful of Office of Food, Chemical Safety, Dietary Supplements, and Innovation. Those are sort of referencing those 3 risk pillars that I mentioned before: micro food safety, nutrition, and food chemical safety. In addition to the rest of our offices, ORM focused on management, that's where I work. Surveillance strategy and risk prioritization. This is fundamentally about applying risk-based tools to manage the various commodity areas that are in our focus. Office of Quality Assessment and Management, which is all about sort of quality and integrity of our laboratory processes. Communications and education and engagement. There's a huge piece, of course, with communicating with the public on various food safety issues and nutrition issues. Compliance and enforcement is essentially our cops on the beat, so to speak, ensuring that there's an appropriate compliance and enforcement aspect, engaging with industry and regulated organizations. Food safety systems partnerships, this is all about those cooperative agreements and grants that we give out as part of the integrated food safety system. Policy and engagement, and this is really where our sort of nitty-gritty reg writing happens, and sort of our guidance writing and so forth, in addition to our folks that do harmonization of international standards from a policy perspective. The biggest office is the Office of Laboratory Operations and Applied Science, or ALOAS. That office is nearly the size as our previous CIFSAN. It's a significant organization and provides a variety of sort of scientific and technical support to the Human Foods Program. And then lastly, another quite a mouthful, Office of Coordinated Outbreak Response, Evaluation, and Emergency Preparedness. We call this one CORE. And essentially, when there is a problem with a particular food, if it's adulterated, if it has some type of, fragment in it because, a machine broke in the manufacturing process. I mean, Cheerios have metal fragments or something like that. This is the group that actually deals with taking those products off of the marketplace in the event of a problem. All right, what follows here are 4 forthcoming acquisition opportunities for this fiscal year in this new Human Foods Program organization. The first of these is the Shipping, Receiving, and Laboratory Support Services. Given the fact that our ALOAS office, the Office of Laboratory Operations and Applied Science that I previously mentioned, is one of the bigger parts of our organization, we have a significant need for operational support for that organization. And so we bundle several different areas of support into one potential vehicle. This includes shipping and receiving support. So for instance, if there's samples from potentially adulterated products that come into the organization that need to be dealt with, if we have laboratory equipment that needs to be handled sort of incoming from a shipping and receiving perspective. There's also a lot of work related to media preparation. As you know, there's a tremendous amount of just sort of sanitation required to have appropriate science, and so there's a lot of sort of support for that, including media prep and glassware washing and so forth, and then also a bit of sort of waste handling as well as part of this contract. Next contract is Leadership Development Board, what we call LDB Support Services. Of course, any successful organization requires sort of building a deep bench of effective leaders, and our organization is no different. As part of that process, we found to be particularly effective to have coaching and sort of executive support related to supporting our organization. And so we have a contract to support the operations of our Leadership Development Board, focused on group coaching, individual coaching, and just sort of overall operations support to really ensure that we have an effective and efficient leadership development program for our organization. The next opportunity to discuss is scientific desktop publishing and editing services. This is really about sort of technical nitty-gritty writing support. As you can imagine, our sort of scientists are pulled in many different ways. They're both doing regulatory response, they're doing scientific development, sort of method development. They're also, as part of their jobs, publishing scientific papers and scientific abstracts and so forth. And so we require some services to help them with some of the sort of fundamental mechanics of some of these paper writings and so forth. And so we've had great success in the past in having technical writers support our scientists with their publication and paper writing needs. And then the last one of these we already went through here is the Shipping and Receiving Laboratory Support Services. And the last one here is the training support for HFP Staff College. So we have a staff college which is separate and distinct from our Leadership Development Board. Our staff college does the training of our internal staff, both our scientists, our risk analysts. They even do some more soft skills training and so forth. And as part of the new org structure, the Human Foods Program, as I mentioned before, is sort of taking in previous portions of the Office of Regulatory Affairs field laboratories. And so we have a need for securing the services of qualified technical personnel to help us on certain kind of technical training needs that we have for our sort of foods program regulated projects. So we give several examples: manufactured foods, retail, shellfish, dairy, and so forth. But this is really, focused on technical training requirements for our programs. So with that, go back to the leadership coaching. Yep. There you go. That's the Leadership Development Board Support Services. So I want about 15 minutes of my 20-minute allocation. Happy to take any questions if folks have any particular questions that they would like to ask of me. Sure. It's fine. I'll just repeat your question.
Good morning. Thank you for being here. Ms. Brown with Tenacity. For these that you've shown, and I may have missed it, but I'm taking notes, are these already small business set-asides?
These are not all small business set-asides.
Okay, so maybe there'll be an opportunity for us to provide responses and market research to encourage these to go small business forward.
That is true. Thanks. Yep. Yes, sir.
Morning, Kamal Khan from Maxwell Corporation. You know, it's interesting you showed the production.
So the question was, you know, given our sort of post-market nature of our program, and the fact that a substantial portion of our program is focused on the post-market space, what are some of the kind of business capability areas that we tend to leverage in the post-market space? So that's a really interesting question. So for any post-market organization, there's several kind of key areas. One is sort of data analysis. So there's a tremendously wide, you know, variety of foods, as we talked about in that one slide. There's over $1 trillion in sort of regulated food-type products in the marketplace, and having sort of an understanding of the complexion of the marketplace is really important for us. So, for instance, information on, you know, product profiles, you know, sort of manufacturing profiles, the various ways in which foods are manufactured, the various types of ingredients and such that they have in them. So a big focus on sort of like surveillance of the marketplace, some various IT tools that kind of take some of that data, sort of ingest it into the program and sort of make good use of it from a sort of an oversight and safety perspective. And then from a sort of another aspect of our program that's very significant is just sort of the scientific technical support. Of course, you know, at FDA, all of our decisions ultimately trace back to sound science. And so there's a tremendous amount of work that we do just sort of developing the science necessarily to, you know, make sure that food is safe and wholesome. And so we have a lot of interest in sort of certain lab operations, laboratory equipment, laboratory support services type functions as well. I'd encourage you all to specifically contact our HFP point of contact, our acquisitions branch chief, Lakia Gaithers, who can provide some of that information. Thanks. Any other questions? All right, well, thank you everyone for your time.
Thank you so much for that. Really appreciate it. Next up, we will have a presentation on the Office of Digital Transformation and the mission and opportunities of that by Mahesh Choksi. So come on up and there you are. Good to see you. Good. All right, I'll hand the time over to you. Good to see you, man.
Can you hear me? Yeah, I see you are all sitting here for 1.5 hours. Maybe you can stand up for a minute or 30 seconds and stand down. So it's okay, just relax. We are just little ahead of the time, so I know it's sitting non-stop might be, yeah. Okay, good. Hope everything is good. So I'm Mahesh Choksi. I'm from ODT, Office of Digital Transformation, Office of FDA CIO, and thanks OAGS for inviting us. I'm one of the program office, and thank you all and all the people who are on the virtually hybrid. So thanks for joining today. Many of you might have come to ODT, the FDA IT Symposium, which was, I think, last week. And you might see some of my slide over here, because it's not repetition, but I try to make sure that there is not that much overlap. As you know, FDA IT budget is around $1 billion, and FDA CIO has an oversight on IT acquisitions. So one of the major things that we have done is about setting up the FDA IT acquisition strategy, and I'll talk something more about it. So first, what's the mission and vision? Mission is serve as the leading force in technology and data. So you'll hear more about technology and data. To advance the FDA public health mission, our vision is to unlock FDA technology and data potential to improve health for all. So our journey started in 2019 when so much modernization efforts are going on, and under that, the first was the TMAP was developed, Technology Modernization Action Plan. Then next was the Data Modernization Action Plan, then Enterprise Modernization Action Plan, then we have Cyber Security Modernization Action Plan, and then the last was Leadership Modernization Action Plan. So that journey started 2019 to 2022. And what are the major challenges as an IT infrastructure that we are on the landscape we are facing is rapidly changing the environment, aging system and equipment. There are so many end-of-life equipments that normally we try to replace those end-of-life in the tune of around $20 to $25 million every year. Data sharing is another major part, because now the data is the power, and there are so much data across the FDA wide, so the data sharing is our major challenge. Budget and cost, as you know, that budget is always a challenge. Talent turnover, there are so many people, there's so much rotation, so that's another challenge that we are facing. And cultural silos, we have all different centers, there are so many different IT activities going on, and sometimes there are some cultural silos over there. So Dr. Calif, our commissioner, he said we need the ability to create systems that allow us to keep up with the complexity of the industries and product we regulate with immense consequence for the health of all Americans. So that's what we are striving toward, to develop systems which are capable to develop and deliver to the American people. So to take care of all these challenges, and the FDA CIO released the first agency-wide IT strategy. So it's coming out because of the Food and Drug Omnibus Reform Act of 2022, user fee commitment, and the GAO assessment. So it comes out that first IT strategy was released in September 2023 last year. To support the IT strategy, we released the FDA IT acquisition strategy in February of 2024. At the same time, the FDA also released the IT operating plan, how we will be achieving the IT strategy. These are the major 6 goals that we are striving towards. So whenever you are writing your proposal, think about this. Creating a shared one FDA ecosystem. Are you allowing to create an one FDA theme? Strengthen the IT infrastructure. Modernize enterprise services and capabilities. Share data of mission outcome. Adopt artificial intelligence and mission-driven innovation. We are hearing a lot about AI and ML, so please make sure that you also adopt it. It's not that adopt it, but try to apply towards our specific use cases and how it will help us. Cultivate talent and leadership. So that's our internal thing, that we are trying to cultivate our talent and leadership so that we can continue to modernize. So to support these goals, IT acquisition strategy has a specific 3 goals. One is the strategic procurement and management, alignment with the enterprise architecture, because there are so many contracting actions are going on, and we want to establish there is an alignment with the enterprise architecture and robust IT vendor management. There are so many vendors, and we need to establish a robust IT vendor management FDA-wide. So what are the challenges that FDA IT acquisitions are facing? One of them is the governance. As you know that there are so many contracting actions going on, so an FDA CIO has an oversight. So how we can establish a governance across all the contracting actions going on, and then there is a one FDA theme is coming out of it. Meeting socioeconomic goal, we continuously strive to award as many contracts to the small business vendor, as Leonard says earlier, and other also said the same thing, that we are trying our level best to achieve it, and in 2024 we achieved our goals. So that is one of our major success, one way. Long acquisitions timeline, so there are some of the acquisitions which has a very long timeline, and we are trying to see how we can do agile acquisitions. Redundant business arrangement, there are some arrangements which are redundant, and there are so many redundant processes are going on, so that's what the business are also trying to adopt and try to centralize processes. Business partners performance management, how we can, there are so many applications we have at FDA which are pre-award. That means before awarding, we have much better control. But after award, once the actual contract execution start, it's really hard to manage the performance of, are we getting all the deliverables? Is it the budget is on the track? Are the expenses are being done in a proper way? Who is working on what for how many hours, at what labor category? That part is really unknown, and that's what we are trying to focus. Enterprise licensing arrangement, you won't believe we have more than 2 million licenses across FDA, software licenses, and we want to identify which are those licenses and how we can make it enterprise-wide. High O&M cost, this is our another major challenge. Our 90 to 93% of our budget is going toward O&M. As per industry standard, approximately 70 to 75% should go towards the O&M. Around 15% should go towards the DME, and around 10% should go towards the innovations. But right now, we are at the stage where we are spending around 90 to 93% of our budget on the O&M, and that's what we are trying to reduce, and there where we want your help. So when you are submitting your proposal, if I am reviewing technically, I'm looking at how are you helping us so that a future, your base year to the option year to the next option year will go down if once it enter into O&M. And get the economy of scale across the FDA. As I said, there is a $1 billion worth of contracting actions going on, and we want to get the economy of scale. So those are the challenges. What are the opportunity for us and for you? Some of the opportunities are setting up large enterprise strategic acquisitions vehicle so that we can have a better governance, we can have a better rate, we can identify how we can achieve the enterprise architecture through it. Vendor management program, we have established an application called eStar, Enterprise Status Tracking and Reporting System. That system won the award of GovFed, GovTech last month, and that application is to identify who works how many hours, at what labor category, on what specific project. So then I can put a finger on it and I can say, okay, this is the person who is working on what. AIM, enterprise license management, that's what we are trying to establish more and more vehicle for the enterprise license management. AIML for data mining and efficiencies, how we can improve our efficiency by using AIML. Get economy of scale across FDA, that's the one major theme, that how we can get the maximum benefit out of it, because there's a lot of contracting actions and so much work going on, how we can reduce our cost. As budget is one of the major challenge, how we can manage our work with that limited budget. Robust processes and innovative techniques. So that's what we are trying to do, the agile acquisition. We have established different applications called ASA. It's kind of a accelerated submission, acquisition submission. So we support our COR. We have our internal meetings going on every Friday, and we give them like 30 minutes. It's called Core Focus Friday. We recently completed our 100 session, and we invite all the industry partners across from GSA, SBA, so that they come and give the presentation to our COR, so they understand what's going on. Enterprise architecture, that's what's the opportunity, so that you need to understand what the enterprise architecture is, what are our processes. There are project intake process. There are different ways that we analyze how the architecture is, how any new development is aligning with the architecture, and the workforce development. So help us if you are to identify what type of, sometimes we may need your help to know what type of internal skill set we might need so that we can support you better. So these are the major things that I wanted to talk to you. I don't know how much time I have. Yeah, it's only 10:45, much faster. Okay, yeah. Do you have any questions? If you have any questions, please feel free to ask, or go ahead, sorry.
Testing. Okay, thank you. Thank you. Kamal Khan from MacPower Corporation. I can tell there's a lot of work being done at the enterprise level. Can you share a little bit more on some of the challenges you're facing as you're implementing your enterprise data strategy?
Yes. Regarding the enterprise data strategy, as you might know, that we have a CDO, Chief Data Officer, and we have a separate division in ODT, and there are groups within FDA which take care of all the data strategy, all the data alignment, and we try to identify how we can collaborate within FDA and try to share the data. So sometimes we do not try to transfer the data, but keep the data into their respective place and then try to share the data across. But all those things are being done through collaborative session across FDA wide, and all the centers, they come together and they identify how we can share the data across FDA wide. And also we are setting up an enterprise wide contract for the data. So that contract is already posted. We already received the proposal. I think it's in the final stage. So OAGS is working to award that contract. It will be a huge contract. So that will also help us to bring all the data-related work under one umbrella. Hope I answered your question. Thank you.
Okay. Hey, thank you, sir. Yeah, David Lane with Gold Belt Health Technology Transformation Group. We specialize in scientific discoveries within the laboratory and procedures. Does FDA have a stance on AI, ML? You've referenced it right now. Is there a chief of AI we can talk to, and what would be what other agencies are calling guardrails, or how you're going to proceed further with maybe internal AI or what they call proprietary AI? I'd like to hear if you had any comments on that. Thank you.
So there are a lot of work going on AI, ML. There are internal discussions going on developing the AI, ML strategy. And we do have some work going on which are very targeted on specific use cases. So AI, ML is being adopted, but in a targeted way. Plus there is, from the administration, there are some policies are coming down which we are following. You can also talk to our CTO, Sohail Chowdhury, and our Chief Innovative Officer, Farhan Khan. So they would be able to help you if you have any specific AI/ML related questions. Thank you.
Hi, Alex Green. I'm the owner of AG Media Agency. We specialize in branding, management, and digital marketing. I saw that you stated y'all had workforce development for some of the opportunities. Can you expound on that? Is that consulting or specifically a general niche?
So most of our workforce development activity are occurring in-house, and they are very targeted approach. So we do all our internal training. We do have one contract was recently awarded last year for training purpose. So in case if we need any specific training for the overall workforce, then there is a contract already. It's a BPA that was last year awarded in 2024. So most of you might have heard about the OAGS Partnership Day that we internally have. So OAGS also give us every month. There are some every month and sometimes bi-weekly. There are training sessions going on for developing the acquisition workforce. On technology side, there are so many. We also have a partnership with large other company who come and give us those type of training like AWS, Microsoft, Fiscal. So there are different type of large OEM. They come and give some types of training also. Thank you. Any other question? Or I think otherwise I'm good? Okay, yeah. Please unmute. Okay. No, please, yeah.
I lost it. I'm not just trying to fill the agenda, I promise. Could Mahesh please provide any updates on the Enterprise Application Development BPA?
Thank you so much, yeah. So,
That was worth the wait. Oh my God.
as you all know that RFI was released in May timeframe, and we received substantial amount of feedback. It was an overwhelming response. It's really good. We are currently reviewing. It's under the review process. Plus, there is a specific approval process also that we are going through it. Timelines are not decided yet, but it's being actively worked on. So it depends on our internal process. It goes all the way up to HHS level. So there are so many processes that we have to take care of. Any acquisitions that comes to you normally, you do not know, you may not know that how much approval process it has to go through. So we have to continuously get the different level of approval. And OAGS is very helpful. Our main CEO is sitting there. Phil Frame, he is the boss, and he is handling that EDA BPA. So thank you. Yeah, I think he's coming. Just one last question, yeah.
Hi, I'm just going to pull on that since it was brought up. Do you think it's 3 months out, 6 months out, 9 months out? Thank you.
Yeah. Go ahead.
All right, so like Mahesh said, we're going through a lot of reviews right now. We got a lot of responses back from the RFI. They have been reviewed. Now we're digesting what we have reviewed to determine how we're going forward. We're going to be doing some more information gathering. Even the information that we got from the responses was outstanding, but how that's going to be then developed into the requirement and rolled in, and it's a lot. Trust me, it's a lot. So when will this come out? When will the solicitation come out? Later this fiscal year? I don't know, honestly, because if it comes to a point to where we're sending our documentation up to the department, which we're hoping to do early next calendar year, so January timeframe-ish, then what are they going to take back? How are they going to digest the information that we give them? And we're in communication with them. Trust me, I mean, we're not doing this in a vacuum and then going to throw the ball up to them. So we're taking into account Cindy, who spoke earlier, so the small business side of things. We're taking into, or we're talking with our legal representation to make sure that what we're doing is legally sufficient. So there's a lot of work that's going behind the scenes to make sure that this is done correctly and giving everyone the greatest opportunity. The one thing, my mantra on this is we are giving small business the greatest opportunity to participate in this requirement. I can't tell you whether it's going to be a total small business set aside, a partial small business set aside, or full and open. But in whatever fashion it is, we are going to give small business participation the greatest opportunity to participate. So just bear that in mind. Have patience. Have faith that this will come out, but it is a very large requirement. This is one of the largest requirements that we've ever done here at the FDA. So we want to make sure that we're doing it properly. And that's our key goal here. And that, again, we are giving small business the greatest opportunity to participate. Okay?
Thank you so much. Okay, I think we are good. Thank you so much. Thank you all.
Thank you very much, Mahesh. Appreciate you taking the time today and having a chance to answer a couple questions. And so we're going to round out the presentations today with a small business success story. Now, you know, when we partner with small businesses, and we use that word partner, right, we want to support small businesses. It's not just about a business transaction. It is about fostering growth in the small business community. Like I said earlier, there is no greater innovation than from the small businesses. And so whenever we have the opportunity to partner with a small business, we're hoping to see success stories like the one that you're going to hear about now. So I'd like to welcome Anna Gilmore Hall up here. She is a registered nurse, executive director of not one but two NGOs, and also the current president of MPFF Federal. She's going to take a little bit here to talk to you about her small business journey and hopefully provide some helpful guidance to those that might want to follow in her footsteps.
Hi, everybody. I am extremely aware of the fact that I am the only thing standing between you and lunch and the networking and the matchmaking activities this afternoon. So I am going to take that into account as I give you a little roadmap of some of the things that we're doing in our journey. But I have to tell you that I'm a little bit like Stephanie, and I like to talk. In fact, when I was growing up, I was the oldest of two girls. My younger sister, she is Joanne. And my dad tells this story how some people came over to the house one weekend and said, you know, we noticed that Anna does a lot of talking and Joanne never says anything. And my father replied, well, you know, Anna's the oldest. We taught her how to talk, and we realized what a mistake it was, so we never taught Joanne. So, and she's a CPA now, and she still doesn't talk. But the challenge for me is now that I have to tell that story over and over again. So I just want to share with you that I am hoping my little talk this morning and the rest of the day we're going to be able to talk about some of the things that we're seeing as a small business, but I really want to hear from you. What are you guys seeing? What are you doing? Because the best advice that I ever get from anybody, frankly, are the other small businesses and large businesses that I spend a lot of time talking to. So I hope that for the rest of the day, we'll have a lot of time to chat and learn about what we're all doing together. So let us pray that I don't screw up the technology here. So we are, in fact, on a journey as a business. We're all on journeys in our personal life, professional lives. And so we are very excited that when we started off as a small business, that we figured out pretty early on a few things that were really going to help us get positioned for growth. And so I want to talk a little bit about those and about the evolution that businesses go through as they grow, and some of the evolution that we're going through right now as we're preparing for our next steps in our journey. So MPF is an 8A Hub Zone women-owned small business. We've been around since 2012. We are very focused on trying to be the best we can, with good best practices. And so we've spent a fair amount of time going out, getting our certifications, trying to establish best practices, so that helps differentiate us with our customers and our employees. And I'm going to talk a little bit about some of the things that we do with our employees to help us with our business growth and to make sure that we are providing the best possible services we can to our clients and to our partners. These are our core capabilities. We do training and technical services. We do clinical research and evaluation, life sciences and animal research support. We do some systems development and operations and some information technology. We're not a big data company. We're not a big IT company, but it's an area of growth for us as part of our emerging, growing company philosophy. And it is obviously something that's very wanted and needed by many of the clients that we work with. We support 15 federal agencies right now at the Department of Defense, HHS, Department of Commerce, Department of Interior, and Department of Homeland Security. And we do work at the VA and the Department of Energy. A lot of our work is prime. We have a lot of prime contracts, but we also have some very good, effective partnerships where we provide subcontracting support for other large companies. And that's been a very successful growth strategy for us, both as being a prime as well as being a subcontractor for other primes. So I have a quick poll I want to do. How many companies here are new, less than 5 years old? All right. How many are 5 years to 10 years old? All right. And how many are 10 years and older? Oh, so that's sort of interesting, about a third, and a third. So when we started off, we were, figuring out how we were going to focus, and this is actually before I joined the company. We had a financial background and business background and some banking background with the owner, and we decided that we were going to try and get a couple of federal contracts. So our first contract was at the IRS, Department of Treasury. That first contract was administrative support. It was providing, we were the engine who helped get the checks out in April. That was our job, get the checks out so that people who were getting refunds got their checks. We don't have that contract anymore, and I kind of wonder now if that's why some of those checks are pretty slow in getting out, because some other contractors doing that. But anyway, doesn't matter. I rarely get a check back anyway, so I don't know what I'm worried about. I usually have to pay. The next thing, when we started off, is we were in Philadelphia and we realized, well, where's the action? So we moved our offices down to the D.C. area, and we have an office in Gaithersburg, Maryland, and we've had a couple of offices in different places. And we're a hub zone, so we have to make sure that we are in the hub zone area. In addition to getting those first contracts, it was also critical to start attending outreach events. And, you know, we had a good panel this morning that talked about those. I think Leonard talked a little bit about it. It is really important to network and do outreach and attend events. I will also, and I'm going to say this 3 times, I think, attending outreach events is very important. People you meet at these meetings are critical. The staff that we meet, the government folks we meet, the other business partners that we meet. But a lot of times we fail at doing the follow-up after the event. I am amazed when Kim said she got 40 cards and ended up doing like 30 meetings. The people I have talked to, they'll say, I'll get 40 cards or I'll get, 100 CAPE statements, and then nobody ever calls me afterwards. Nobody sends them an email. So if you're going to do, spend money, attend an event, spend your time, you've got to do the follow-up because they're not going to remember you. They're not going to remember that we talked about this opportunity at 2 o'clock on Tuesday, and then they go back to work, and then you go back to work, and you're doing other stuff, and it just never happens. I am really getting better at that because when I go home now after attending an event, I block off time on my calendar for follow-up. Because otherwise, if it's not on my list and it's not on my calendar and Alexa doesn't tell me to do it, it's not going to get done. So I have a plan now of how I do that follow-up after attending outreach events. Same for talking to other partnerships, to other companies. If I don't follow up with somebody afterwards, they're probably not going to follow up with me. Now, sometimes that's not true, but that's my job after these kinds of meetings and events, and it's critical. I mean, I just can't tell you how critical I think it is. So I want to finish on talking a little bit more about lessons learned. I think it was Leonard who started off today with the 4 Ps. And I guess I'm continuing into that effort of the 4 Ps. People have talked about this a little bit, but I think, again, I want to emphasize preparing. We've talked already, but one of the things that I do for these network events is a lot of homework. Who's going to be there? What are the opportunities? What's the forecast? And I try to come up with a name or 2 of people that I want to meet at the event. I called some folks yesterday and said, hey, you coming to the FDA event? I'm going to be there. Nope, okay. Kim and I talked this morning about some people I wanted to meet that I hadn't met yet. I said, are they going to be here? No, unfortunately they aren't, but I'll introduce you. Kim and some of these other folks are great at that. If you want to meet somebody and you don't know them, ask somebody to introduce you. Most of the time, people will do it for you, and it works very well because, I'm probably old-fashioned. I like the face-to-face interaction with people. When COVID hit, we had to do all of the, Zoom calls and team calls and all that kind of stuff. I mean, we all learned to do it, but I don't think it replaces the face-to-face talk time that people have and the dinners and the drinks and the drinks. That's all really good. That's really, really good. So preparing for the network event, doing your homework. I was going to tell the story that somebody told this morning. I've seen people go to these events or go and meet an SBA person or, a contracting officer and say, well, what have you got for me? And if I were that person, I would say, nothing. That's not my job. What do you got for me? People talked about it this morning. So know what you're going to pitch when you get there. Know your customer, what their needs are, and then be very careful to listen to what they say. One of the things that I do, at least according to my husband, is I am so excited to say something that I'm not a very good listener. So when you go to these events, listen, because they will tell you a lot of things, even inadvertently, about something that's going on, maybe something about a competitor or a hot point that's going on at a facility. So the more you do your listening and flexible in the response to what you hear when they're talking to you, the better off you're going to be, I think. Partnerships, people talked about that this morning. one of the really good things that has happened to us is we've established really good partnerships with companies, with competitors from time to time. You know, some days you're a competitor and some days you're a partner. And we also seriously take that conversation about the client is the partner. We are there to provide service that is required of the contract, but we really do look at it as a partnership with our clients. And so leveraging that partnership and helping our staff understand how to leverage that partnership is becoming more and more of a focus of us, of our support. People, right time, right place. One of the things that when we first started off, we were very focused on putting people into positions. You don't want turnover, you don't want vacancies. Get the right people in the right job and keep them there for as long as possible. That has been very successful. We have a very good retention rate for our employees and our staff and our consultants. But one of the things that we've started doing now is making sure that those people that are working on the contracts also understand that part of their job is to really expand the relationship with the customer. So you may be working on a contract, but if there's something else going on in that agency or in that office that we can provide support to, we're trying to get our people to expand their relationship with the customer and the client to help them understand how we could better help them and maybe solve a solution, come up with a solution and solve a problem they don't even know they have yet. Or they know they have yet, but they don't know how to get it resolved. So we can help them do that. And then performing. I took this tagline from another company, actually, who had done a previous presentation. Deliver strategic value, don't simply do executive tasks. I think one of the things that we can do to differentiate ourselves, especially as a small business, is be that strategic value to the partnership with the other company, but more importantly, obviously, to the client. Make sure that you're just not going through the method, going through the effort of doing work, but they understand that you are bringing strategic value to that relationship and to that customer. Help them solve problems they don't even know that they have. And the other thing that we are trying to be a little bit more careful about is developing a strategic plan for the growth of the company, where we're going, how we're going to evolve, and making sure that we're communicating that to our employees and to our partners. And when I think you're small and you're first getting started, you're just kind of trying to get the first contract, second contract, third contract. Once you're starting to get a little bit more established, you have to come up with a more strategic approach to how you're going to do things so that you are using your resources well, you're using your time well, and you're providing support for the people that are working with you on the contracts to make sure that everybody is getting what they need to be successful and keeping the client happy. I've talked about it 3 times. These meaningful partnerships are critical. We have been a protege to another company who was our mentor, and we've been very successful at getting contracts and leveraging their relationships with customers and clients, and we're starting to do that now. We're going to be mentors and working with other companies as our protege. Those strategic partnerships have led to our greatest percentage of growth. So yes, we are a prime contract and we're doing good work as prime, but our strategic partnerships have allowed us to do more work at the FDA, to move into other agencies and other federal opportunities like USAID, for instance. We just formed a new partnership and we just got 2 contracts with them. And we wouldn't have done that if it hadn't been for the relationship and the partnership that we established with that other company. So it's critically important. My job in most instances is to be the person who does a lot of networking and to find good partners to work with. And I do that through these kinds of events. But, some of the more interesting ways that we've established relationships and partnerships is dinner and going out at social events. I met somebody I guess it was last year, at an event at my church, and we were talking, and you know how they say one thing and another. Oh, what do you do? Well, I'm a federal contractor, and you know, we're talking. Then I find out that this woman is doing coaching and training, and she worked at Franklin Covey, and she knows this person and that person, and we just happened to be thinking about a new opportunity. Well, the next day, she and I got together, we put together a proposal, we submitted it, we won. And then she introduced me to 2 other people, and we also did the same thing with them. So when I'm talking about establishing partnerships and building relationships and networking, it isn't just at these kinds of events. I just had a new neighbor who moved into my neighborhood. He works at NASA. He's the head of the operations that move the big cranes and platforms for when the missiles and the spaceships take off. And so I talked to him a couple of weeks ago, and I said, well, you're doing work at NASA, and I'm a federal contractor, and we're looking at doing a couple of things. So he's going to talk to his boss and see what we can do to see if we can pull something together. I don't really know if it'll go anywhere, but I didn't want to lose the opportunity to talk to someone who worked at NASA who was also, you know, barbecuing with my husband. And then the last thing that came up recently that I thought was sort of interesting in a partnership, we had people that had previously worked for us, went to other companies, and they remembered how, you know, they liked us, they liked working with us. So when they went to the other company, they called us up and said, hey, I'm in a new company, can we get together and have a meeting? That has led to new partnerships, new opportunities. We're bidding on a couple of contracts with the new company, and I have a call this afternoon with somebody that I haven't met before as a result of an employee leaving us and going somewhere else. So all of these things I just bring to your attention to say partnerships, relationships. It's good to write a good proposal because obviously you've got to do that, but a lot of our work, a lot of our strength and growth has come from partnerships and relationships. And this is just a follow-on in that. I think it was Kim who said it this morning about knowing the small business reps, the program people, and sometimes the program officials can be hard to get a hold of and know for a new opportunity. But if you can talk to some program people where you're currently working on a contract, sometimes they can also hook you up with some other folks. So these relationships are really important and they really matter. They also matter because if things do go wrong and you have a good relationship, it makes it easier when you say, you know, we kind of had a little boo-boo here, we got a little problem going on, what can we do together to fix it? That conversation is a lot easier if you have a good relationship with the program people and with the contract staff. Just say the obvious here. How many of you are 8A companies? All right. How many of you are thinking of becoming an 8A company? All right. Our experience in the 8A program has been very positive. We have gotten sole source contracts. We have competed and won on contracts. We're able to differentiate ourselves in talking to other partners to leverage our 8A, woman-owned, hub-zone status when we're talking about different things. And so next year, we're going to be graduating from the 8A program. And so for the last year, year and a half, we've been thinking about what's it going to be like after we graduate from the 8A. A lot of companies, when they graduate from the 8A, they get in trouble because they haven't prepared for graduation. They haven't prepared for the new life that it's going to be like after they graduate from the 8A. And so we've been spending a lot of time and efforts preparing for our graduation and making sure that when we are no longer small and getting some of the benefits of the 8A, that we'll continue to grow and be successful. So we are growing. We have 400 employees now. When we were a lot smaller, we were able to do things a little bit more, we were fast and flexible. We still are fast and flexible, I think. But we've had to build an infrastructure for things that we didn't have when we were very small. So we have a greater payroll department. We have a larger HR department. We have a large recruiting team to help us for getting vacancies filled, but also to help us find people for bids, for proposals that we're working on. So we've had to build a lot of new infrastructure that we hadn't had before. We've also put in place processes and procedures that we didn't have when we were small. We want enough process to be good, but not so much process that we turn out to have bureaucracy. So that's been a little bit of a challenge trying to figure out what that balance is. We're expanding our headquarters resources. As I said earlier, we have more HR staff. We are doing some additional education for our staff, our headquarters staff, as well as our staff that are working on contracts. So it's been an evolution for us, and we're continuing to expand that evolution. And then recruiting, retaining staff. When you have more staff, it's more complicated. When you have more SCA staff, it's more complicated. And we have a lot of contracts where we have entry-level admin type of folks up to PhDs, scientists, nurses, and other kinds of folks. So there's a lot going on in managing all of those staff. So we have done, I think, a very good job of getting ready for that, for those steps. And then as any small business, there are external challenges that we have to deal with. And one of the things that I was going to ask our panel this morning was the expanding, my impression, the expanding number of protests that are going on now. Obviously, if you're an incumbent and you lose, you might want to do a protest because the cost of the protest might be outweighed by the advantages of keeping the contract for 3 months or 6 months or something. But there seems to be a lot of protests. And for small businesses, that can get expensive and very time-consuming. It's hard to keep the staff that you might have hired for an award continually engaged because now you've got another length of time for protests. And so we've now started talking about the process for identifying an opportunity, bidding on it, doing the proposal, doing this, doing that, protest period, and then award. It's like a new step in the evolution of managing your business model and doing your forecasting. If you think you're going to get a big contract, what are the odds of a protest? That's now become a new check mark in our decision-making around bidding and no bidding. And then some of you probably see this as well. We see a lot more LPTA contracts. And for a small business, I mean, big business is probably the same, but for small business, looking at those LPTA contracts, are they going to be profitable enough for us to really to go after it and win? There's nothing worse than, bidding on a contract and spending all that time and effort and resources and bidding on it and losing, unless it's doing all of those things, bidding on a contract, winning, and you go broke managing it. Or you have a very unhappy customer because you can't keep and retain the staff. So we're spending a lot of time looking at those kinds of contracts and trying to make good, hard decisions about whether or not to bid or no bid some of them. I have worked in the nonprofit world, when I was younger, and I was a nurse. And when I decided to kind of leave the not-for-profit world and go into the for-profit world, I thought, I'm going to sell my soul to the man, this is just going to be crazy. And then I found out, I like the company that I'm working for, I like the people I'm working for, and I like the clients that we have. And so now when people say to me, what do you do for work, or, what's your job, or tell me about the company you work for, I am very excited about the work we do because in one way or another, I feel like we have something to do with public health. And I can get excited about that, whether I'm doing work at the FDA, if I'm doing work at the Department of Commerce, if I'm doing work at NOAA. We are doing something around public health. I feel like I'm making a difference. And that gets me excited, and I think that I have a pretty successful way of conveying that excitement to the people I'm talking to the partnerships that I'm making, and to, frankly, future clients when we're doing outreach to them. And I think that excitement comes through, and if it doesn't, you need to think about your business model, because if you can't get excited about your business, who else is going to get excited about it, right? The other thing is, as an employer, if we get excited and talk to our employees and our staff about our excitement, hopefully they also get excited about it and get more involved and can do a better job. And we try to do a lot of things with our employees to keep them engaged, so that if here's an example, if we're talking to cage washers that are working on one of our animal research contracts. Well, cage washing can be a little, boring maybe, and maybe not as stimulating, maybe. But if you're helping the team find a cure for childhood asthma, I'm going to go clean that cage really well, And so thinking about how we can help our employees and our staff better understand how we are making a difference, no matter what we're doing on the contract, I think makes them happier, more successful, more interested in engaging, and more likely to go out and talk to other people to come work for us, or to be able to go out and talk to the client and get us some more work. So it just makes sense to us. And then finally, as a partner for the government, sometimes, and you guys should close your ears about this, sometimes we all hear comments about the government and federal employees, and they got an easy life and all this kind of stuff. And I take a lot of effort in saying to folks, I work with the government. I work with the individuals who work for the government. And these people are doing a good job, and they're doing the best job they can, and there's a lot of good things happening. And so be excited that this is happening. Be excited that the government is doing these kinds of pieces of work, because if they don't do it, nobody else is going to do it. So making a difference and helping the government, I think, feel better about what's going on with their work, I think is important. And I don't want to sound Pollyanna about it, but if you can't get excited about what you're doing, then you should go find something else to do. So, all right, that was everything I had for my part of the morning, and I am on time. So anybody have any questions? Or do you have some comments that you want to make? Because, again, we're here to all learn from each other and talk with each other. So anybody want to talk about something?
Oh, there we go. Good morning. I'm Renita Anderson from Defense Technology Integration. We're an IT firm. Knowing what you know now from your journey from the beginning to today, as a small business, would you have done anything differently?
Oh, I think everybody would say they would do things differently. We'd do something faster. There have been a couple of contracts that we bid on that, we want to, like, well, maybe I wouldn't do that one again, We've had a couple of partnerships that didn't quite work out, but, that's true for everything. I think trying to be a little more focused, when you're first getting started, to just, increase your efficiency might be something that we would do differently. But it's a journey. You have ups and downs, and, there's exits. They go nowhere, and then they got exits that are shortcuts. So It's fun, it's exciting. Every day is different. You never know what's going to happen, you know, in the course of the day, and it's a good life. It's crazy sometimes, and sometimes the government drives me crazy, and sometimes my partners drive me crazy, but good life.
Hi, I'm Taylor Vincent from Teslate Consulting Group. We are a strategy management firm. I was wondering, I think a lot of times we can focus on the negative interactions with the government or how it's really hard to move things forward. Can you talk about some of the positive interactions or those key interactions that got you to where you are today?
Oh, let me think. Oh, God. No, that's cute. Actually, there were several that I'm thinking about. So here's one. When we had an animal care contract, and I was a little nervous. You know, I'm a dog owner, and I was like, what's this going to be about like? And, you know, I'm a nurse, so I know about clinical research. And I had this very negative feeling about perhaps some of the staff that I might meet. And when I did a site visit and I saw how much the PIs loved their animals and took good care of them, and we had enrichment programs for our animals. And that was early on when I came to MPF. And I thought, oh my goodness, you know, all of those negative things that I thought I had in my head that I was going to see and think about when I came here did not happen. It was really a very positive experience. It really was. And then on a couple of our FDA contracts, we had a contract with CTP, and we were doing undercover buys with minors for tobacco products. And that was sort of interesting, working with the minors and the chaperones and the inspectors and the kids' parents. And it was a little exciting. But we were, you know, talking with them a couple of times about why they were doing this and how it works and how you get involved with the teenagers. And one of the inspectors said, you know, not only do we, you know, kind of cut down on smoking and, you know, take care of, you know, sort of bad actors in the industry, but, you know, again, it's about public health. It's about why I'm doing this, because I care about kids. And so when you start to know the government employees as people who have loves and hates and interests and why they're doing it, they're not just doing it for a paycheck, that's what I think makes a difference for the work that we do with the government. Did that answer your question? Yeah. So.
Hello. Thank you again for speaking today. I just kind of wanted to, I think, you know, we spent the morning session, the government talked to the small business community, then now the small business community talking to the small business community, just kind of give you an opportunity as, you know, kind of a representative of the small business community to talk to the government. You know, what is some... Aren't they supposed to play music to, like, talk you out? What would you...
Several things. All right. First of all, I'm a big Christmas nut. You know, holidays are big thing. Do not put out a solicitation the week before Christmas and ask for the responses on January 3rd. That's the first thing. We have had a couple of situations where we've reached out to, and you talked a little bit about it this morning, the program staff about a solicitation or a bid coming up, and they said we can't talk about it. Well, you know, there's no RFI out. It's 6 months away or longer, and say, well, we can't talk about it. We can't talk about it. And we say, actually, you can. You know, there is nothing wrong with talking to us about this. And sometimes I think they're doing it because they don't want to talk, And sometimes they're afraid. They don't know what to say, you know? And so if there, and I know this is done, but if there was a way to sort of reinforce for program staff and other staff, when people are asking you about these solicitations, you can talk to them. You're not going to inadvertently give them insider information. You can have those conversations because you really want to make sure that the contractors are educated and know about the work, the scope of work, and what's going on, and maybe some of the challenges that you're having. So figuring out a better way to communicate with the government staff about when and how you can talk to contractors, I think would be very helpful to us. And these kind of events are very helpful. They really are. I would do more of these. I would do more industry days on some of the big opportunities and proposals that you're working on. And I don't quite know how you do it, but the fact that the government has a focus on small business is very well known to us. And I'm not sure that society and the community understand how important the government is putting on small business. And I think it might be more helpful to better educate the public that the federal government wants to support small businesses. We know it, but I'm not sure that the public appreciates it. And it would be helpful for them to get a better understanding of that. I might be wrong in that. I just don't know.
So this is a loaded question because I'm asking not for our perspective, but for our program offices again. When you say you want an industry day, or you want to have an industry day for an action, what are you looking for from the government when we hold this industry day? In other words, we hold this, okay, well, what are you looking for from us? Mm-hmm. Because I know when we from the contract shop present it to the program office and say, yeah, you want to hold an industry day? Let's do it. They're like, well, we don't know what to do. We don't know really how to conduct an industry day. So what's the perspective from a small business or from industry as far as what they want?
Mm-hmm. I think we're trying to get a better understanding, a more complete picture of the scope of work and what's happening, what the needs are, what the hot points are, so that we can do a better job of planning and come up with better solutions, more effective solutions, and perhaps more efficient solutions for whatever the issue is or whatever the project is. The other thing is, if there were program folks there who could engage with us, and as we're learning about the opportunity, they can get a better sense of what small businesses can do. We have done some work at NIH, and FDA is very different than NIH. And they're not always the most friendly to small businesses for some of the work that we want to do. And so getting a better understanding from the program side about what small businesses can and can't do could be accomplished, I think, by some industry days where there's more interaction between them and us. Does that make sense? What do other people think? What do you think that industry days are good for? Or maybe you disagree and say, no, they're a waste of time.
I have another question, but I'll answer that since I've been to a lot of industry days. Industry days are good for us when we went there with our primes. Usually industry days are done for a huge contract, and they're at the solicitation phase, like, what do you think we should do here? Is there a proof of concept with this work? And that's usually done by the large companies of the world. But when we go there and we attach ourselves to somebody who might win this when they become, then at least we are there for the journey. We are able to, as a small business, contribute or know that there's no play for us and just go spend our resources and time somewhere else. My question, I'm a small business owner, FAR Consulting. We've been in business for about 20 years. About 2022, when COVID started, going away and we're back to work, our commercial work went down, and we were in a position to jump in and be a government contractor, which we've been registered since 2019, and we have all the work laid out for the last 12 months, from GSA contract vehicles to ISO certifications, and we are also an 8A. So my question to you is, take me way back, or through the experiences that you have today with small businesses. Sometimes it's really hard to keep banging on the same doors and not get a break. So how did you overcome that hump, or your new businesses that you work with?
So persistence is part of the key, and it's that follow-up that I mentioned earlier. I have a strategy. If I'm going to do an outreach after an event, or I'm trying to reach a contracting officer or specialist, I email them, I call them, I email them. Now, if the third one doesn't work, then I'll say, either I'm going to find somebody else, or I'm going to just bag it, because this isn't going to go anywhere. But I think you have to have kind of a strategy and a plan for how you're going to do the outreach, and understand that it's not going to happen the first time, it's not going to happen the second time, and sometimes it can take 6 months of tracking somebody down before you actually make it happen. It's not a fast-moving, quick capture plan for the federal government, like I perceive it to be for the commercial side, and it's a different kind of industry. Things take a lot longer to get done in the federal government, and if that's the business you're in, you just have to understand that it's going to take a while. I don't know if anyone else has a contrary thought.
Sanjay Magoon with Cardinal Technology Systems, 8A and a Hub Zone company. Getting back to the industry day, I think what would be very interesting and important for the vendors to know is what the strategy is in terms of evaluation criteria, not the instructions, but the evaluation criteria, what the bounds of the contract would be, because sometimes you can have JVs, sometimes you can't have JVs. What would be, and in terms of the strategy, would they be an unrestricted track, or a small business track, or a socioeconomic track, all those sorts of things, and to be able to actually give enough runway for the vendors to actually create the partnerships and the strategy from our side. So I just wanted to mention that, and that would be wonderful to know. Thank you.
That's a great point.
I wanted to address the question about what small businesses want from the industry days, just to offer another perspective. So I think this approach that FDA is doing today is spot on. The small business offices, the contracting offices, procurement offices are always there. You're always present, and we appreciate that and the information that's provided. What you're doing that's different is you have program here today, because those are the kinds of requirements and details that small businesses or large businesses want to understand more about. And now that we are working in a hybrid environment, it's more difficult to reach the program staff to get those detailed requirements. And so having that ability to have that one-on-one interaction, specifically with small businesses, so that we can describe at a detailed level how we can add value and what we bring to the table for the government, is really important. And that's how they know that we're here and what we have to offer. And then also, in echoing what you described about a perception that industry may have about federal government employees and workers, I was a federal government employee for 30 years. And we work hard, you work hard. Federal government employees are some of the brightest, smartest, hardworking people on the planet. And so now that I have a small business cap on, I have that perspective of being a Fed and then now being a contractor. And so as industry, we need to give our federal government employees some grace because there's thousands of us and there's a few of them, and we are ascending on them and trying to get information, and they are trying to be as helpful as they can be.
I have had such outstanding interactions with contracting staff, small business people. I mean, truly outstanding. My small business rep, I have called him on a Friday afternoon with a question. He's called me back Saturday morning at 7 a.m. I mean, the next day. Of course, it is the only day I get to sleep in, but 7 a.m. on a Saturday, he's calling me back. I mean, that's fabulous, you know? So, yeah, I take a lot of pride at being able to say to people, you don't know what you're talking about, and working with the federal government is an honor. So, Heidi?
Hi, Anna. My question is about indirect rates. So when COVID hit, a lot of people went virtual, which then said to everyone, why do I have leased space? One of our biggest indirect expenses, of course, is leased space for our corporate facility. How important do you think it is, from the government's perspective, in your opinion, to have physical office space versus a company that we're competing with that doesn't have those costs and can get their indirect rates lower and then win on a contract based on those indirect rate structures? So I'm just wondering how you feel about leased facilities and those indirect costs. Are they costs that are valuable from the government's perspective, in your opinion, or do you think that they're wasted costs?
So I have two thoughts about that. I have heard from multiple government folks that it's very hard to get staff to come back. You know, people like working from home and they don't want to come back. And people would leave and go someplace else. So I think just as the government's having that difficulty, some of us are having that difficulty getting people back, you know. I'm old-fashioned. I like having them in the office, and I like being in the office, although I telework a lot. So it is a challenge, and I'm not sure that it is a conscious decision that the government and us can make about leased space, that we want it this way and that's the way it's going to be. I think we have to deal with the reality that the workforce is changing and they don't want to come back to work, 5 days a week. And I don't think that's going to change anytime soon.
Okay, thanks, Anna.
Yep. So I think I am getting pulled off. I appreciate the time talking to you guys today. This has been fun, and I look forward to talking to some of you this afternoon.
All right, thank you very much. That was a fantastic presentation. Hopefully you got a lot of good tips from that as well. Great conversation and questions. I'm so glad to hear that this is spot on. We have worked really hard to curate this event and those like unto it to be as helpful as possible. That is our goal. To end our morning session, we are going to turn the time over to our CFO, Benjamin Moncars, to give us some closing remarks. So, lucky you. He's a great guy. So, here he comes.
Good morning. How's everybody doing today? So small businesses, you all are an integral component of the work that we do at FDA. And I know you've heard this morning from Leonard Grant, our director for the Office of Acquisition and Grant Services, and you also have heard from a variety of different folks from our team. But again, the reason that we have days like this small business fair is we really, you all are critical, and we want to make sure that we are providing the resources, the tools, the education to really get information out there, and then also to build, as Leonard said this morning, that partnership with small businesses, because as you all know, the FDA mission cannot fail, and so that we were very reliant
on small businesses. In 2024, we take, the goals that are provided to us from the department very seriously when it comes to awarding and competing awards to small business. And we were able to obligate $769 million in fiscal year 2024. We also met all of the goals from the department when it comes to small business. This is one of the many events that we have during the year, and so we welcome your feedback. We look forward to the continued partnership, and we're going to continue doing what we can. I know we do our best to keep small businesses apprised through our small business customer exchange, customer experience, to provide data of what's coming and what's out there. And so I won't take up too much time before lunch, but really I also want to thank and commend the entire OAGS team, particularly Caitlin Lowe and Cynthia Okoye, for all of their efforts. So this day is not easy to put together. It's a really important day, and so we look forward to the continued partnership. Please, as Leonard said, there's a lot of folks here from our OAGS team. Look forward to the matchmaking this afternoon. Please, it's great, the folks that we have online as well as in the room, and so really looking forward to the afternoon and to building this continued partnership. But again, small business, you all are really the backbone of this economy for our country and then also for the FDA. And so look forward to continuing to get your feedback and continuing to improve and enhance your experience and doing everything we can to make all of you successful. I will turn it back to Dan before lunch. Thank you all.
All right, thank you so much. We're just going to have a couple more words here before lunch. The Menti will be up on the screens to give us feedback on everything, so that'll be fantastic. What was the other thing we were supposed to say? We had one other thing, didn't we?
Thank you, guys. So we really appreciate everyone this morning. We did one meeting. We wanted to give everyone an opportunity to get a meeting as we talked today about how important that matchmaking is. We are happy to report that some companies will be able to get a second meeting. Not really a fair way to do this, but I think, if you could make like a orderly line, if you'd like to sign up for an additional meeting. OC is full and ODT is full, and a lot of them are filling up very quickly. So we do want to extend the opportunity. There will also be no appointment required in the large business partnering room. And then also we have our GSA customer service managers where those bathrooms are. There will be a room with them. They'll be the first room, and then the second room will be the OSDBU specialists, Anita and Cindy. So thank you guys so much for attending. We really appreciate it. If you have any questions or feedback, please complete the Menti, which is coming up in a minute. It will be on the screens. You can scan it and give us all the feedback, and we really look forward to getting your feedback and, the matchmaking this afternoon as well. Thank you.
All right, thank you. Enjoy your lunch.